Hi, everyone. I'm Doug Whiteside. I'm the training director for our adult clinical neuropsychology postdoctoral fellowship here at the University of Minnesota. I'm really happy that you're interested in our program and are looking at this video today. We wanted to take a few minutes of your time and just introduce ourselves. And I'm very excited. First, I'd like to just basically introduce our core faculty here. We have Eric Waldron, who is our associate training director, and Aaron Holker, who is our division head. And then we have Jim Porter, who is one of our neuropsychologists. And then last but not least, our newest neuropsychologist, Courtney Eskridge, who recently joined our faculty, and we're very excited to have her here as well. So thank you, everybody. And thanks for, as I said, watching. We are a small group, but we are a very dedicated group and with considerable experience. And we think we have a very fun group. And we also have a large group of psychometrists that many of our postdoctoral fellows get to work with. And you would also have an opportunity to do that as well as part of the fellowship. I came here about 2 years ago, actually just before the pandemic, from the University of Iowa. I got my training at the University of Nebraska and did my postdoctoral fellowship down in Albuquerque in the desert Southwest. I have a number of interests of my own in terms of my clinical and research work. I very much consider myself a generalist, although recently I've been doing a lot more work with long COVID patients. We started a clinic in our department, and I've been seeing the majority of those folks, and we're also putting the data together and conducting some research on that. So that's kind of an exciting area for us, certainly timely. And so that's part of what I do. But otherwise, I see pretty much, anybody who needs a neuropsychological evaluation. So I have a pretty broad and diverse practice and everything. So what we're going to do today is just each of us will talk a little bit about our own interests in our own areas, just so you can kind of get to know us a little bit. I also want to just make one mention here. There's coming from Minneapolis, we are certainly aware of issues involving diversity, equity, inclusion, and the importance of those. And so we've made a very strong commitment to recruit underrepresented applicants, people from communities of color, immigrant communities, folks who may not have as much opportunity as others. We certainly encourage and welcome those applications and really want to bring a lot of our expertise to helping everybody become clinical neuropsychologists. And then finally, I have kind of a very exciting announcement. Some of you or all of you may have heard about this revision to the Houston Conference Training Guidelines that began last year through AACN and is on its way to having a conference next September. I believe it's going to be September 12th. And I'm very excited to announce that we're the host institution for that because we're centrally located and we have a lot of facilities that'll support the conference. So that'll be a very unique and exciting opportunity for anybody who's here, because it'll be a very much of a all hands on deck approach to pulling this off. So we're very excited by that. It's really quite an honor. So I think that's just a little bit about myself and my interests. Personally, very involved in music. I'm a musician, love to go traveling and hiking, those sorts of things. And my wife and I do that quite a bit. So anyway, that's a little bit about myself. All right, so let me turn things over to Eric Waldron, who is our newly appointed Associate Training Director. I'm very excited to have Eric in that role. We've been working together, and Eric will talk a little bit about what he's doing. Eric?
Thanks, Doug. Yeah, I'm Eric Waldron. I've been here at the University of Minnesota for 7 years now. Prior to that, I was a fellow and then staff at the University of Iowa. I did an internship at UCLA and then graduate school at the University of Houston. Since I've been here, I've been very active in working with the epilepsy group here and do the WADAs for them and see all the pre and post-surgical patients, and have also been actively involved in working with the neuro-oncology group. Um, Additionally, like Doug, I'm a generalist as well. I see patients, all comers, all adult patients, and we tend to have a pretty strong focus on neurology patients in our group. Like Doug said, I'm the associate training director, so I've been actively involved in developing our didactic program here, both our internal didactics for our fellow as well as for our practicum student or students in the future. So we've been meeting on a weekly basis for those, and we've also developed a collaborative didactic series with the different postdoctoral programs here in the Twin Cities. So the pediatric neuropsychology group here at the University of Minnesota, the VA neuropsychology program here in the Twin Cities, and also through Alana and Courage Kenny. And so on a monthly basis, we've been having meetings where there's a faculty presenter talking about a topic area and then leading a case presentation. We also have, on a monthly basis, have been having professional development series talks through that collaboration. And then on a quarterly basis, we've been having diversity based talks. So it's been a really, I think, unique and exciting opportunity for trainees to get a chance to meet trainees from other institutions, as well as to get experience and exposure to the different expertise of faculty from a bunch of different institutions. So it's a lot of folks. I think it's a great opportunity as well to learn more about adult and pediatric experiences for people who have different focuses. Personally, I'm married. I have 2 kids, a son who is nearly 8 and a daughter who's nearly 5. We're a pretty active family. We spend a lot of time outside in the summer riding bikes and playing at the park. And in the winter, we spend a lot of time skiing and being outside. So I think that's enough about me. I'm going to turn it over to Erin.
Thank you, Eric. I am Erin Holker. I'm the Neuropsychology Division Director, and I also serve as the Vice Chair of Clinical Affairs for the Department of Rehabilitation Medicine. So I have a broader role within the department as well. I've been at the university for a long time, for about 20 years. I came here right after my postdoctoral fellowship, which was at Mayo Clinic in Jacksonville. Before that, I did an internship at the Memphis VA, and my graduate training was at Pacific Graduate School of Psychology, which is now Palo Alto University in California. So I've been at the university for a long time. We are kind of our division, the Division of Neuropsychology, has been associated with the Department of Rehabilitation Medicine for since the mid-1990s. But our lab, our group, the neuropsychology group, has actually been present at the university since the mid-1960s. So Manny Meyer developed our lab here, and we have grown it. I'm a generalist. I see any type of adult patient for the most part, but my real interest both in research and clinical work is with movement disorders. And so I see all of the patients who are coming through the University of Minnesota for deep brain stimulation surgery for any movement disorder related issue, or also we're seeing some patients for obsessive compulsive disorder and other reasons now as well. So I serve on the team there, and I'm part of the movement disorders division in the Department of Neurology. We are housed in the Department of Rehabilitation Medicine, but we have really close relationships with all the other departments in the medical school, including neurology, psychiatry, primary care, all of the other departments. And we have kind of a unique opportunity here because we are the adult neuropsychologist for the institution. And so we just see a very broad range of patients. It's always exciting. We never know what we're going to encounter from day to day. And it allows us to really offer kind of a breadth of experience and depth of experience for people in different areas. I guess a little bit about myself. I have a couple of kids as well, but mine are a little bit older. My oldest is almost 20. My youngest is 14. And we have chickens and a dog. We used to have more animals, but we kind of it's narrowing down a little bit, but we still have our chickens and dog. We like to take our dog out that's kind of our favorite activity, is finding places to go hiking with our dog, who loves to be off leash and running around. And the Twin Cities are really a great area to do that. And I think that's everything about me. I'll pass it on to my colleague, Jim Porter.
Yeah, hi, I'm Jim Porter. So I'm an assistant professor here in the department, of course, clinical neuropsychologist. I am in my 5th year here at the university in this clinic, but I did my undergraduate through PhD work all at the University of Minnesota. I did an internship through the VA in Des Moines, Iowa, and then I did a postdoc at the Benton lab at the University of Iowa, where Dr. Waldron was as well. My interests here are primarily memory and aging, and also solid organ transplant and mechanical circulatory support evaluations. So people that are needing lung transplants, heart transplants, heart pumps, pancreas, livers, kidneys, all sorts of things like that. A subspecialty of folks that you might get to see, assessing the presence of dementia in older patients with Down syndrome. And then aside from that, just a generalist, connections with the multiple sclerosis clinics in neurology, sort of as a backup for Dr. Holker in the DBS side of things. And again, it's a generalist like my colleagues as well. So we'll see all sorts of patients together. I'd like to just pass along then to Courtney. Oh, you know what? I guess one thing, just personal information about myself. Married, 2 kids as well, 2 and 8. Spend most of my time reading, watching movies, listening to the news, and feeling bad that I'm not as physically active as Dr. Waldron. So that's a little bit about me. Go ahead, Courtney.
Hi, everyone. I'm Courtney Eskridge. I am the new neuropsychologist here at the University of Minnesota, and also an assistant professor through the Department of Rehab Medicine. I grew up in Minnesota, but I completed my PhD and did all of my clinical training in the Chicago area. I actually recently completed my postdoctoral fellowship at Northwestern University. And I just started here in October of 2021, so still establishing my clinical practice. You know, like everyone else, I'm a generalist, seeing a variety of different patients, but my clinical interests are in neurodegenerative disease and aging, as well as neuro-oncology and cancer-related cognitive changes. I'm very excited about the opportunity to be a supervisor for trainees, but also as a mentor, as I very recently underwent the licensure process and the job search process as well. Just a little bit about me on a more personal note. I spend most of my free time with my husband and my very large ragdoll cat, Leopold. But I also enjoy traveling, camping, cooking, and reading. So that's a bit about me, and I'll pass it back to Doug.
Thank you, Courtney. Well, I hope this video has given you some at least initial sense of who we are, what our interests are. I think, as I said, we have a wide variety of different interests. We see a huge diversity of different types of patients, and so if you're looking for a generalist postdoctoral training program, we're well suited for that. We start at age 18 and we go up through the lifespan. And as you may gather, in addition to all the kind of general sorts of patients we see, we have a number of really interesting specific areas. So I hope you're interested in that. I look forward to reviewing your applications. If you have any questions, feel free to reach out to me or Eric or really any of us. Of course, we have our website and we have the handbook on it. Feel free to review that. But we look forward to reviewing your application. We will be planning to have interviews in January. We will be doing video interviews again, Zoom, much like this video is. That worked well for us last year as part of the pandemic. We're continuing that. ABSIN has recommended that all its programs do that, and we're following those recommendations. We feel that's the the best, most equitable, safest way to do interviews again this year. So we'll be reviewing applications, and selected applicants will be setting up interviews in January. And that'll, again, be on Zoom. So I think that's pretty much everything, at least in a nutshell. As I said, feel free to contact me with any questions or anything. I'm more than happy. If I don't know the answers, I will direct you to the right place to get the answers. So again, you have a good day and take care. Thank you so much. Bye-bye.